about the importance of having people know that the vaccine is safe and meeting them where they are. To continue this important discussion, I am so honored that Dr. Anthony Fauci has joined us today. He has advised 7 presidents on global health, and as a trusted and familiar public health leader, I know his voice and insight matter to our residents. With that, I'd like to turn it over to Dr. Fauci for some brief opening remarks before we move to the questions that have come in from our community. Dr. Fauci.
Thank you very much, Ms. Alsterbrook. It's a pleasure to be here with you today. As we all know, we don't have to be informed of the extraordinary crisis that we have experienced over the last year, including those of us in the Washington, D.C. metropolitan area, including Prince George's County. We have had now over 450,000 deaths in the United States and well over 24 million infections. We are still in the middle of an outbreak that, although it is starting to plateau in the sense of looking at the number of cases, we still have a number of challenges ahead. The light at the end of the tunnel is vaccines. We have been fortunate enough that we have made investments in the development of and clinical trials of a number of candidate vaccines that have proven to be highly efficacious with a very good safety profile. Our job now, and really is a task, is to get as many people vaccinated as quickly as we possibly can, because the way you end this terrible scourge that we've experienced over the last greater than 1 year is to get everyone protected, such that we have an envelope or an umbrella or a blanket of herd immunity over the community. And that can only be accomplished by vaccines. So one of the reasons I'm enthusiastic about being with you today is to be able to answer questions you might have on any aspect of the vaccines that are available, the preparations that have been made, and any concerns that you might have. So with that, I'll stop and be very happy to answer questions.
Thank you so much, Dr. Fauci. I will turn it immediately over to Dr. Wright, who will help us to answer some of the commonly posed questions. Dr. Wright?
Yes, good afternoon, Dr. Fauci. We've heard from the community concern about differences between the 2 vaccines that are currently available, and is one better than the other? And what about the Johnson & Johnson vaccine that is in the process of heading to emergency use authorization? There is concern about the vaccine as a single shot, but also apparently less effective than the other 2. Can you address that question, please? Thank you.
Okay, so the 2 vaccines that are currently being administered are what's called mRNA vaccines, one from the company Pfizer, the other from the company Moderna. They have shown in clinical trials of 30,000 people with the Moderna and 44,000 people with the Pfizer trial to be highly efficacious in preventing clinically apparent COVID-19. In other words, to prevent you from getting clinical symptoms. It is 94 to 95% efficacious and a very good safety profile, with nothing really of any great concern, some allergic reactions with people who have a very strong history of severe allergic reactions to the tune of anywhere from 2 to 6 per million. But other than that, the safety signal is fine. The Johnson & Johnson or Janssen one that is right now in the process of having their data evaluated by the FDA, it looks like the efficacy there is not quite what it is with the Moderna and the Pfizer, about 72%. However, one thing about it that is very favorable is that it is extremely effective in preventing serious, severe disease, including hospitalizations and deaths. So although the number 72% isn't as what you might think would be as favorable as 94 to 95%, it still is value added and would be a very good addition to our armamentarium of vaccines, which we will have. So we hope they get their EUA. And if they do, I think it would be a very important addition to the vaccine profile that we have now available to us.
Thank you.
Good afternoon, Dr. Fauci. It's an honor. This vaccine has been developed so quickly. How do we know that it's safe and effective?
Well, that's a great question. And I'm glad you asked it because it's asked often. The speed with which we went from a realization of the genomic sequence of the virus on January 10th of 2020 to the time we had a phase 1, phase 2, and then a phase 3 trial, to the point that we actually were putting vaccine into the arms of individuals by the end of December of 2020. That speed was not a reflection of cutting corners. It was a reflection of the extraordinary advances that were made in the science of vaccine platform technology. And as a matter of fact, that work had been going on for about a decade before the virus was actually recognized. So although it seems that it was cut short with regard to time, in fact, the advancements were purely reflective of scientific advances. So people should not feel that the speed is a negative. The speed is a very positive thing because it reflects extraordinary advances in science.
Dr. Fauci, perhaps the most common question that we're hearing in the community, is it possible to get COVID-19 from the vaccine?
Well, the answer to that question, Dr. Wright, is absolutely no. It is impossible because what you're being injected with is a messenger RNA that codes for a single protein, the spike protein of the virus. It's not like a live attenuated virus where you actually inject the virus into the person. The virus is not in anywhere near in the situation of getting into the person who receives the vaccine. What they get is a coding sequence to code for a very specific protein. So the short answer to your question, it's impossible to get COVID-19 from the vaccine.
Some of our residents ask about getting the flu shot. Some of them never get it. They ask, why do I need to get this flu, to get a shot?
Well, I think the numbers are answering that question. There have been now 440, close to 450,000 deaths in the United States due to COVID-19. Particularly susceptible are African Americans and Latinx, who have a much higher rate of infection, hospitalization, serious consequences, and death. So the good reason to get vaccinated is to protect yourself, to protect your family, and to protect your community.
Dr. Fauci, there have been many reasons expressed for vaccine hesitancy. One of them is a mistrust in the medical system due to the history of the natural experiment known as Tuskegee around syphilis, and also the biologic exploitation of the family of Henrietta Lacks. How can we be reassured that the vaccine is not negatively targeting communities of color?
Well, the concern on the part of brown and Black people about engaging in a program, a medical program that is run by the federal government, is understandable. And I think the first thing we need to do is to respect the concern of people of color who have hesitancy, but on the same time to explain to them that the ethical safeguards that have been put into place since Tuskegee and since the Henrietta Lacks incident are such that those types of things would be impossible under today's conditions. You cannot get a clinical trial done unless it passes very strict ethical review. So right now, we need to inform people in the minority community that vaccines or any other intervention are under very close scrutiny by ethical boards, as has been the vaccine program for COVID.
Dr. Fauci, there's a rumor going around in the community that the vaccine works because it changes the recipient's DNA. Is that true?
Oh, absolutely not. The vaccine has nothing at all to do with modifying your DNA. It's an mRNA that codes for a protein, and your body will make a response against that protein. It's a very commonly asked question, understandable because they hear the word messenger RNA, but it has nothing at all to do with your own DNA.
Dr. Fauci, the recent passing of high-profile people like Hank Aaron has sparked rumors in the community that the vaccine is killing people. Is the vaccine deadly?
Well, absolutely not. In fact, there are very close follow-up to see if there's any association between the vaccine and any other deleterious events, including death. And this vaccine has a very good safety profile and did not kill Hank Aaron.
Dr. Fauci, many people wonder, why do you have to continue wearing a mask after they've been vaccinated?
Well, that's a good question. What we know from the clinical trial is that the vaccine prevents you in 94 to 95% to get what's called clinically recognizable disease. It is conceivable that the vaccine can prevent you from getting clinical disease, but you still might get infected without any symptoms. If that is the case, it is conceivable that you have virus in your nasopharynx, and even though you're protected from disease, you might inadvertently spread it to someone else. So the purpose of wearing the mask is to prevent you from spreading virus, if you happen to have it in your nasopharynx, to someone else. As the months go by and we get more information as to the efficacy of the vaccine in actually preventing true infection, not just clinical disease, then there might be modification of that recommendation. But for now, just to be sure, we recommend that even though people get vaccinated, that they continue to wear a mask.
So Dr. Fauci, what happens if I wait and don't take the vaccine until later in the summer?
Well, then you're putting yourself at an extra risk. And that's the reason why we tell people, when the vaccine becomes available to you, please take it and don't wait, because every day, every week, every month that you delay, if you have it available to you, you're putting yourself at risk for getting infected with this very difficult virus, as you know, that's killing so many people.
So Dr. Fauci, how long does it take for the vaccine to start working?
Well, it starts working moderately, not optimally, about 10 days to 2 weeks following the first dose. You get optimal protection about 10 days to 2 weeks following the booster. And as you know, with Moderna, the booster is 28 days later. And with Pfizer, the booster is 21 days later. So about a week and a half to 2 weeks following your second dose or your boost, you get maximum protection.
So Dr. Fauci, if others around me are getting vaccinated, do I really need to?
Yes, because it depends on what you mean by others around you. There's a thing called herd immunity, which when maybe 85% or so of the population gets vaccinated, it brings the level of virus very low in the community to the point where there's sort of an umbrella of protection for everyone. But until that point, everyone should contribute, not only to protecting yourself, but there's a secondary benefit. You can be part of the effort to protect the community, including the vulnerable people who, for one reason or other, the vaccine does not have a good effect in them, such as people who are immunosuppressed and may not make a robust response against the vaccine, against the virus, that is.
Will a vaccine be effective against the new COVID-19 variants?
Well, it depends on the variant. The one that is now in the United States from the UK, the vaccine looks like it's very good against the B.1.1.7 variant. It is somewhat less effective against the South African variant, but nonetheless, it still falls within the range of protection. So we feel it is quite good against the UK variant. And although there's some diminished protection against the South African one, it likely would still protect.
How do I know there won't be long-term complications from the vaccine?
Well, that's a very good question. If you look at the history of vaccinology, essentially all of the so-called long-term adverse events occur within 45 days of your last dose. And for that reason, the FDA does not allow a vaccine to be used on emergency use authorization until 60 days following the time when half of the people get their last dose. So people don't fully appreciate that you can't even get a vaccine on an EUA until you've waited 60 days after the last dose in the clinical trial. So that means that you've covered well over 90+% of all the possibilities of there being long-term effects.
Dr. Fauci, what are the most common side effects and how common are they?
Well, I can tell you from my own experience, because I think I had what's called a prototype experience. After the first prime, my arm hurt a little bit. If I pressed on it, I felt the little ache in the arm. Went to bed at night, woke up the next morning. It lasted maybe into the next day, but by the time of the nighttime of the second day, it was gone. A little bit different with the boost. With the boost, which was 28 days later for me, again, I had a little bit of an ache in the arm, but towards the evening, I started to feel a bit fatigued, maybe a little lower back muscle ache that made me feel not 100% normal. It didn't prevent me from coming to work. I did everything I do normally on a working day, went to bed, woke up, it got a little bit better the next day, and by the following night, I was back to 100% normal. So for about 24 hours, you may be fatigued, you may have a little muscle ache. Unusual to get fever, but it has occurred in some people. I did not get fever, but some people do get fever.
And to that end, Dr. Fauci, why do we need to take a boost?
Well, in order to get the maximum response, we know clearly that you get some response after the primary, but the maximum response, for example, the level of neutralizing antibodies after the boost is about 10-fold greater than what it is following the prime. So you get a very good benefit from getting the boost.
Dr. Fauci, is it true that there's not enough doses for everyone to get a second? And should I go ahead and get my first dose anyway?
Well, you definitely should go ahead and get your first dose. There's not enough to give everybody in the country a prime and a boost right now. But as we go from February to March to April to May, there'll be many, many more doses available. So our recommendation is when your turn comes up, get your prime, and I'm certain you'll be able to get your boost also.
Dr. Fauci, I'd like to thank you for taking time to address questions from our community. This has been immensely informative and helpful for all of us. And I turn it back to Madam County Executive to close us out.
All right. Thank you so much to Dr. Carter, Dr. Wright, for guiding this conversation. And to you, Dr. Fauci, thank you so very much for taking time to join us this afternoon. We are most grateful. We are not only grateful for the work that you're doing, but we're grateful also for your commitment to science and to facts and doing all that you can to end this pandemic. I'm pleased that many of our residents were able also to listen to this today. And we're going to make sure that as many of our residents as possible have the opportunity to hear this conversation and your answers. Please know that we are right next door and we welcome you back to Prince George's County at any time. And to our residents, I hope this conversation has helped you understand more about the COVID-19 vaccines. As all of the doctors have said today, the science tells us that these vaccines are safe and effective and really do protect us from COVID-19, but only if we take them. When we take the vaccine, it not only protects us, but also our family, friends, neighbors, colleagues, and those with whom we worship. When your turn comes, I encourage you to sign up to receive the vaccine so you can join us in being proud to be protected from COVID-19. If you want to learn more about the vaccines or pre-register to receive a vaccine appointment, please visit mypgc.us/COVID vaccine. Thank you again to Dr. Fauci, Dr. Wright, and Dr. Carter. May God continue to bless everyone who's watching today, and may God bless Prince George's County. Thank you so much, everyone.
Thank you. Good to be with you.
Thank you.